Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. So there was a patient in, as a matter of fact, just yesterday, and we take a microscope slide on almost all of our patients. So when we took the slide, this is what we saw. Well, initially we see plaque. Now, plaque is not necessarily harmful in itself. What we're really looking for is moving bacteria. We're looking for parasites and bacteria that are related to gum disease. Now, this is a parasite. It's an amoeba. It's an amoeba. And if you watch it closely, you see how that's coming out? That's called a pseudopod. And that's how these amoebas move. What they do is they extend these pseudopods, and then they use those to embrace and devour other cells, like white blood cells, and that's what they live off. Studies have shown that when you have these parasites, not only do you have gum disease, but you have a very increased risk of Alzheimer's disease, heart disease, stroke, all cardiovascular diseases, diabetes for sure, now certain cancers like pancreatic cancer, particularly for men, lung cancer. So in the treatment, we want to make sure that we eliminate these parasites and bacteria completely. When a patient's finished, I want to take a slide and see nothing moving around on there. No bleeding, no activity. One of the things that we can do, that you can do, to treat periodontal disease in its maybe very early stages and help prevent it is the simple use of dental floss. Periodontal disease usually starts between the teeth, where bacteria and food particles lodge and aren't or can't be removed completely with the toothbrush. The brush does a good job of brushing the outer surfaces and the inner surfaces, but not so good between the teeth. So let me give you a little lesson in how to use dental floss here. When you use dental floss, well, I'm going to use a little yarn. Let's pretend this yarn is the dental floss. So first of all, you don't want to use a long piece of floss. You want to use a short piece because you can control it much better. Short piece between thumb and index finger, or 2 thumbs typically, and you take that floss and you put it carefully between the teeth, kind of like that, and you work it down between the teeth. Don't snap it down. Don't let it snap down. Just this tooth is a loose tooth, by the way, as you can see it moving. You move it along the side of the tooth, and you kind of polish the side of the tooth up and down like that. Then you wrap it around the tooth adjacent to it, and you polish that up and down. Go 5 or 6 times up and down the side of each tooth, then go to the next area and basically do the same thing. And by the way, when you are flossing, that gum tissue between the teeth is called a papilla. Well, you don't want to irritate the papilla. Go up and down the side of one tooth and bring it up over the papilla to the other tooth, so you're not rubbing it across that tender tissue between the teeth and irritating it. And then move the floss along so you're not using the same contaminated, worn piece of floss in each area. Now, floss is the narrowest of all of the materials that we use. Tape is a little bit thicker and works well. Now, in some areas where the teeth are really kind of far apart, you can actually use yarn. You want to use something that will fill that space and clean it out thoroughly. But generally, dental floss or dental tape will do the job. So you've got a small piece that you can control, and then with that controlled piece, 5 or 6 times down to the gum line and slightly under the gum line, but don't snap it, don't push it down any further than it'll go comfortably, to clean the plaque and the bacteria and the material out from around between and the sides of those teeth. So cleaning between the teeth is really, really important. Dental floss, even yarn, are some of the things that you can use, but that's a critical area to clean. So remember, healthy mouth, healthy body, stay well.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.